Hi, Robin Roland here. I'm going to continue with our policies and procedures manual. Treatment planning. An individualized treatment plan will be developed as soon as possible following admissions, but no later than 7 days following the admissions. The treatment plan will become part of the client record. The treatment plan reviews will be conducted based on the client's progress, a minimally of every 30 days. The client, family, clinical team will be involved in developing and reviewing the treatment plan. The procedure for treatment planning. All treatment plans will be in collaboration with the client, family, utilizing the client's words. Treatment planning will include the member's family, and the clinical team. The treatment plan will target or reduce or eliminate the symptoms of behaviors regarding from the client's psychological disorder, which prevents the client as functioning as best as possible. Planned services will be determined by the assessing clinician. The frequency of services and identified provider will be stated on the treatment plan. Changes to the planned services will be documented on the treatment plan. The transition discharge plan will begin at the time of admissions and will be documented on the treatment plan. All individuals involved in the treatment plan development will sign and date the initial treatment plan. At minimum of every 6 months, the treatment plan will be reviewed by the provider, client, family, and clinical team as necessary. Progress will be documented and the revisions will be made during this review. Reviews will be documented in the client's record. All individuals involved in the treatment plan will have signed and dated the treatment plan review. Recommendations and referrals from outside services documented in the initial treatment plan will have a follow-up in the review section during the treatment plan review. Progress towards the recommendations and referrals will also be documented in this treatment plan. Now for the treatment plan, it is the policy of TSI to develop a comprehensive mental health individualized treatment plan, which becomes part of the client's records. Treatment plans will be developed as soon as possible following admissions, but no more than 7 days after admissions. Treatment plan reviews will be conducted based on the client's progress. Treatment plans will be reviewed at minimum of every 6 months. Procedures. Clear and concise statements of the client's strengths and needs. Clear and concise statements of long-term goals and short-term objectives that will be attempting to achieve while in treatment. Specific activities and assignments of those goals. The frequency of the activities and sessions to be determined by the clinician. The plan will be culturally and environmentally specific to the client's needs. The plan will be developed with the input of the client, the family, other professionals working in the client team. The plan will be written in terms that the client can easily understand and will address mental and emotional and functional adaptive disabilities. The plan will be written in terms that the client can easily understand, and it will address mental and functional disabilities that negatively impact the client's well-being. What we are doing is as a target to reduce and eliminate symptoms or behaviors resulting from the member's psychological disorder that prevents the members from functioning at the best possible level. The counselor or therapist and client will review the plan as often as required within the required timeframes. A copy will be given to the client upon request. Revisions will be made during the review if needed. Accomplishments and needs will be discussed during the treatment plan review. Changes to the plan will be documented in the client's record. Each individualized plan will be documented in the client's record and will contain the following information. The member's name at the top of each page. The member's state identification number will be at the top. Member's date of birth, address, date of plan completion, date of any revisions, clinician's name, address of the facility in which she writes the order, all 5 diagnostic criteria based off the clinical assessment, the staff's name, member's legal guardian, provider number, supplemental service the child may be receiving. Then we'll have goals and objectives that are each individualized to the member, reflect the mental health diagnosis, measurable, and time limited. Now, there are specific treatment plans for substance abuse, and there are treatment plan reviews that are different. That will be addressed in the Substance Abuse Policy and Procedures Manual. The treatment plans will be developed within the iSmart system. The plan will be developed as soon as possible following the admissions and the time frame based on the client's level of care. Treatment plans will be reviewed within 7 days. Clients admitted to the intensive outpatient treatment will have their treatment plans developed within 7 days and reviewed every 7 days. Clients admitted into the extended outpatient treatment will have their treatment plan developed within 30 days of admissions and reviewed every 30 days. Continuing care clients will have their treatment plans developed within 30 days of admissions and reviewed every 30 days. These timeframes are minimum requirements. The procedure: clear and concise statements of client strengths and needs, clear and concise statements of long-term goals, short-term objectives, and the client will be attempting to achieve while in treatment. Specific activities and assignments to meet those goals. The frequency of the activity and counseling sessions. The plan will meet culturally and environmental specific needs. The plan will be developed with the input of the client and the clinical team. The plan will be written in terms the client can easily understand. The counselor and the client will review plans as often as required in the specific time frames depending on the level of care. The reviews will be electronically signed, and the counselor and a copy of the plan will be given to the client upon request. Revisions will be made during the review. Accomplishments and needs will be discussed. Changes in the plan will be documented in the client record. So that is what we have on treatment plans. Stay tuned for our next section on Policies and Procedures Manual. Thank you.